I never thought that social workers were the ones who made changes in the law. Someone else bigger and more important must be taking care of that. We were there to help people, not draft legislation. But I was wrong. If social workers don't make the changes, or at least start making noise about what needs to be changed, nothing will ever change. Listen to Christina, a social work student, and ask yourself if you ever felt like her.
I couldn't affect policy, that my voice didn't matter, and that was just like another world from where I was at. I felt like that my place was only to help clients one-on-one, that it was for someone else to change the policy that would in turn affect my practice, but it was not my place to do it at all. Never voted, wasn't interested, simply thought that my vote wouldn't count, so what difference did it make if I voted or not?
Do you recognize any of your feelings in Christina's words? You probably do, but what's the big deal? So what? You came into social work to help people, didn't you? What do politics and policy have to do with that? The answer is everything. Let's hear how policies affect social workers and their clients each and every day. Lack of community-based services for the mentally ill keeps people from treatment. Families that are dropped from the welfare rolls are also being denied Medicaid benefits. Recent program cuts reduced substance abuse treatment funds for probationers and juvenile offenders. State Medicaid budget reductions are stopping prescription refills for low-income elderly and disabled persons and closing down dental services in rural areas. Victims of domestic violence have to take unpaid work leave in order to receive medical or psychological services. The working poor can't afford health insurance for their children. Mothers on welfare can't substitute post-secondary education for TANF work requirements in order to improve their job prospects. Elderly persons are dropped by HMOs without adequate notice. Runaway teens are often released to parents who fail to supervise them, and they run away again. Homeless kids are forced to change schools when parents move from one school district to another. Who is creating solutions to these problems? Who is advocating for clients' rights? The Code of Ethics requires social workers to become change agents, and the effective social worker intervenes wherever it does the client the greatest good. This means that social workers must influence policies in their states and communities and help shape the future for their clients.
You must compromise.
Can social workers and social work students do it? Can they affect policies according to social work values? Can you do it? The answer to these questions is yes, but you must be aware when policies affect clients. You must really believe that you can influence policy. You must take the first step and get actual experience. You must overcome your fears and doubts. Students quickly learn how policies affect their clients.
I realized policy affects practice when I was involved in the legislation assembly of 2001, and I was tracking a bill that actually failed. It didn't make it through, and it would have an effect on the treatment for juveniles in mental health. So I realized at that point, I think that policy, it does affect practice.
I would say that I first realized that when I was working for a family health clinic, one of those, it was Medicaid family health clinic, and I realized that, you know, my patients couldn't get basic services that they needed. I had a young boy who was 8 years old who had a tumor on his arm, and he needed to go see a dermatologist or orthopedist, and he had to see all these different people, but Medicaid just wouldn't allow him. They only had one orthopedist to serve, you know, 3 million people, so I couldn't get this child in to see a doctor. And then I realized, well, that's just crazy. And then you realize, well, that's how the regulations are written, and that's how the resources are distributed, and that's obviously as a result of the policy. So then just working on the everyday level with these patients, trying to get them just basic medical care, and realizing how the policies were creating barriers maybe that shouldn't have been there.
I guess I realized that really during my first semester of graduate school. I was taking policy course, and my professor does a lot of work in welfare to work and welfare reform issues, and I happened to be placed, my field placement was at an agency that did welfare to work services, and so I was sort of seeing this, we were learning in class about welfare reform, about welfare policies, and I was seeing it put into practice in my field agency. So that juxtaposition really made me look at how directly the reforms that were made in '96 and all the welfare to work issues that have been implemented since then have really filtered down from the government level to the client level.
During my first year of field placement, I was placed at Eastern State Hospital, and at the time there was a bill being introduced in the General Assembly to downsize or restructure all of Virginia's mental health facilities. Eastern State was going to be directly affected, and they were going to downsize and send a lot of the patients back into the community. And being that I was a social worker there at this time, these were going to be my clients that were going to end up back into the community, and I knew that was not the best place for them and that they couldn't receive the best treatment there. So it was at that point that I realized that what was happening at the state level was going to directly impact the people that I worked with every day.
Let's look at what these students actually did to advocate and influence policies.
I had to analyze a policy change, and what I focused on was an area of my practice that I worked in the domestic violence agency, was something that I had always that had bothered me. I'd worked in Massachusetts before I came to Virginia, and victims who were in a dating relationship were eligible for protective orders in Massachusetts. However, in Virginia they were not, so they were excluded. I did a lot of work with college students and high school students in my practice, and I had to really talk to them and talk to them about dating violence and the issues at hand, and when they asked me if there was any legal remedies, I always had to say no, and that always bothered me. So when I did this assignment with Dr. Schneider, I focused on that, and really it takes a small amendment to make that change, and when I wrote the whole paper I thought, why haven't we made this change? And what I realized was that because nobody had actually gone out and tried to make the change. It wasn't because it wasn't necessary, it wasn't because it wouldn't be helpful, it was just that nobody had taken that step or that time to do that. And I realized that all it took was one social worker to do that.
I think it was my phone call to the Richmond Times-Dispatch writer saying, we got to do something for these people. I got involved in the Rayon Park project, which was it is a community in Richmond, and they were having difficulty with their septic systems. And it was in the paper a few times just that they were applying for money and asking for the state government to fix the problem, and it just seemed like they were not being heard or didn't really have one person that was standing up for them and saying, you know, this has to happen, we're living with sewage in our backyards. And I just read the article and said, somebody's got to speak for these people.
One issue that's been kind of important to me throughout this year is the issue of drug courts. It's kind of a new, effective, innovative way to deal with non-violent drug offenders. And with the budget crisis, it's been something, unfortunately, that's lost its funding. And so throughout the process, I did go to the legislator I was working with several times and, you know, explained to him what an important program this is. And while he agreed with me and did what he could to stop that funding cut, he was overwhelmed vote-wise and overpowered. So even though it didn't come yet to a positive outcome, just instructing and educating my legislator on what this program is, and you know, that's what I knew about, so I could inform him about what goes on there.
Last year, the Social Work Policy Practice Forum was encouraging students to prepare testimony on one of 4 or 5 bills that they were addressing in Congress. And I wasn't really considering this at first until I looked over the bills and I saw that there was one being addressed that would develop a National Center for Social Work Research. And being that research in the social work profession is a very important interest of mine, a personal interest of mine, I really felt a lot for this bill, and it was very easy to research. It was very easy to gain information on, so I did that and I prepared testimony. And in last October I went to Washington, D.C. and presented my opinion to a congressional hearing.
I participated in at least for one night, and it was a citywide effort to provide shelter for anyone who who requested shelter on this particular night. And basically what I was charged to do was to go to all the homeless shelters and say to them, look, anybody asking you for shelter, I need you to shelter them for one night. So I said, no, I couldn't do it. There's no possible way this is going to happen. They're going to say, who are you and how long have you been interning at this agency? But blessedly, they all said yes.
When I was a master's student, my second year master's program, I was placed at the California State Assembly with the Human Services Committee and with a wonderful assemblywoman, Dion Aroner, who was a social worker herself and was a really strong advocate. So for working with her and working on the bills through the Human Services Committee, we dealt with a lot of different bills, mental health parity issues, women's health issues. She had a euthanasia bill and things of that nature. So I really worked kind of hands-on with her.
Like you, these students had fears, but they overcame them.
I had to overcome that idea that we can't change things, and that, you know, we're just students, and, you know, what can we do to help, and, you know, we're not professionals yet, you know, or that kind of thing. That what do we know? I had to get over that and kind of say, this is what I can do, and I can do this for your agency. You know, let me help you.
Again, it's taking that faith walk. It's believing that you have something to offer and that you're credible by the mere fact that you're a citizen. And also that it just takes one phone call. It takes one letter. It takes just turning off the movie and watching the news and seeing what's going on. And just believe in the credentials that you have merely by being the person that you are, which is a caring professional.
My advice is to kind of jump in, see what you can do, not be afraid. It can be scary. I mean, the legislature isn't really the most friendly place all the time. However, when you get down here and you really get a little bit more comfortable with it, you understand the legislators are regular people.
It seems really intimidating at first, and it seems very overwhelming at first, but don't get boggled down in all of that, and try anyways, and go down there and observe and get involved anyways, because after you start, it's not until after you start getting involved that you start to relax a little bit and realize that it's not as big a deal as you're making out to be.
So now it's your turn. What can you do now?
I think it's important for clinical students to know how their agencies are funded. Where does the money come from, and how does it come? So that they know how to advocate for increased funding, different funding, differential funding, other resources coming into the agency.
So to be political. I think that all students should be political and looking at, because every policy that I feel that we have is a political policy.
So there's a number of things that as a student you can do to get that experience, to get that feeling of how can I be effective in the political and policy arena.
I participated in Rally Day in, I believe it was February 1st of 2002, when the schools of social work all over the state of Virginia and the local NASW chapter converged on the Capitol.
I'm working at the Urban League and working with the homeless population in housing and credit counseling, and we've done a lot in terms of getting grants and programs started for the homeless.
What I've discovered is that the first thing that students have to do is they have to come to believe, they have to come to feel that they can make a difference in the policy and the advocacy arena.
Where can you start? Get out of your comfort zone.
I saw people in my classes that were passive or just soft-spoken and weren't really sure how to be an advocate or take social work to that big level, and you got to try and push beyond that and understand what a difference it's making for people. And I think everybody has it in them to be an advocate for your clients. I think that's what, you can't really be a social worker if you're not going to go that extra step.
Ask your professors for advocacy and policy assignments. Identify an issue or problem you want to change.
Find something they really enjoy. If you have an issue that you feel passionate about, children, the elderly, mental illness, any people that you feel really strongly about, get involved, get to know what the policies are out there about that, or the things that are affecting your agency.
Form a group at work or school to help you advocate.
Made some phone calls and got involved, and it turned out to be this big project, and it was already kind of in process when I jumped on board with some other students, but it definitely got media attention when we got involved, and we were asking a lot of questions. Why is nobody doing anything?
Contact your legislators and ask them to help you introduce a bill.
In the fall, probably around October, talk to him about introducing this bill as part of maybe a project for me as a social worker, sort of combining the legislative issues with the social work issues.
Develop fact sheets and policy briefs. Join a coalition dedicated to your issue. Testify at a hearing or committee meeting. Persevere and be very determined.
I was not liked in the beginning of this project by a lot of people in the state government. There was a comment, I was quoted in the paper as saying that, you know, I can't believe these people have lived their lives complaining about this problem and not having people, their government, do anything about it, and that upset a lot of people. There were phone calls made to the school, so I had to, and you know, I wouldn't say I necessarily overcame those barriers. I didn't even let them get in my way.
Log on to www.statepolicy.org.
Start using the web quite a bit. Start using your internet resources. You know, you can get in touch with a lot of people, create knowledge for a lot of people, and sort of disseminate it in a way that we never had before. So I think that that's also a really strong advocacy component.
Listen again to Christina.
Now I see that the policies affect my practice and my practice affects the policies. You just kind of have to get in there and do it, and when you get in there and just kind of delve in and do it, you see that it's not, your fears are very unrealistic. It's not what you thought it was. It's very, I ended up feeling very comfortable at the end.
Remember, policy affects practice, and you can affect policy.